Hello, my name is Chen and today I'll be discussing with you the advancement in a cancer imaging tool. Firstly, let's all understand what is cancer. The answer begins in our cells. Our bodies are made up of trillions of them and are constantly dying and regenerating. Normally, a cell divides and makes a perfect copy of itself using a genetic blueprint called DNA. That copy also divides and so on, while older and damaged cells are taught to die off, making way for new healthy ones. Once in a while though, the DNA blueprint in a cell can get damaged. Sometimes the cause is a chemical or environmental carcinogen. You might even have a hereditary risk for cancer. Other times, we don't know the cause. Normal healthy cells are highly regulated by your body and listen to signals for when to grow, divide, and die. Sometimes these cancer cells appear when DNA is damaged and cause the cells to stop listening to the body and ignore the body's signals. And so this rogue cell keeps on dividing and dividing, eventually forming a mass. This mass is called a tumor. In some cases, the cancer stays put and is localized. In other cases, the cancer spreads or metastasizes. When they are metastatic, tumors consume the body's resources as they grow, destroying healthy organs and tissues, and have the capacity to split off into other organs or tissues in other parts of your body. Each year, over 15,000 people in the US undergo surgeries to remove brain tumors. So what are the treatments we have right now? If caught early, many tumors can be removed with surgery, radiation, and radiation is also another kind of treatment. It attempts to kill cancer cells by aiming small doses of radiation at very precise areas. And at times, cancer spreads to distant tissues. But in this case, doctors may use chemotherapy, which attack rapidly onto dividing cancer cells. Unfortunately though, radiation kills all cells in the area, including the healthy ones that are exposed to that treatment. And chemotherapy also attacks other healthy cells that divide, such as the ones that make up our hair cells and our skin cells, causing symptoms of hair loss and digestive problems. There is also a new way though, more effective and less toxic kind of treatment undergoing research called genome sequencing, which uses drugs that are precisely targeted at the underlying DNA mutations that are causing a tumor to grow. Although it does sound promising, research shows that the dosage amount remains unclear to different patients. In some cases though, the drug would be effective and in others it did not. Surgery has traditionally been and remains the first line of therapy for patients with primary tumors. For some tumors, complete surgical removal is sometimes possible. However, tumor removals do not mean that you can't forget about it. Cancer tissue is often difficult to identify with it, not visible to naked eye or felt by fingers. This often leads to cancer tissues being missed during tumor removal, leading to about 20 to 50% of patients having reoccurrence. Undergoing surgery also has a risk of nerve damage due to nerve tissues being extremely small and very often tucked away under the soft tissue or encased within bones or even the cancer itself. Nerve damage could potentially lead to chronic pain, paralysis, urinary incontinence, or sexual dysfunction. Fortunately though, in November 2016, the University of Pennsylvania found a way to help surgeons cut out brain cancer with precision via glowing tumors. What do you mean glowing tumors? Well, they have created an experimental cancer imaging tool which relies on an injectable dye where it illuminates the cancerous tissues. This makes nerves and most importantly tumors glow brightly under a specific light called near-infrared and has the potential for real-time imaging during surgery, identification of the disease, and most importantly precise detection of the tumor's margins, allowing physicians to distinguish the cancerous cells. This has shown promise to patients with brain cancer and lung cancer. The technique uses near-infrared or NIR imaging and the contrasting agent is indocyanine green or ICG, which glows bright green under the NIR light. The indocyanine green agent was first developed during World War II as a dye in photography and in 1958 was approved by the US Food and Drug Administration for use in medicine. However, for this study, the researchers used a modified version of ICG at a high concentration, delivered about 24 hours before the surgery, to enhance the green glow. The molecule has a shoe-like structure. One arm has a positive charge that causes it to stick to all of the cells of the body and the other arm has a strong negative charge that neutralizes the molecule, preventing the positive arm from sticking to the cell until the right time. Attached to the end of the arm are two different fluorescent dyes that cancel each other out when in close proximity. When the molecules comes in contact with enzymes that are found specifically in tumors, the back of the molecule is cut, freeing the positive arm with its dye attaching to the tumor cells. This gave surgeons the ability to see deeply within the cell, within the brain, before the tumor is exposed. Once open, all tumors were picked up by the NIR imaging, demonstrating a visible glow through the dura, which is a thick membrane on the meninges of the brain before opening. Over the past 3 to 4 years, 300 surgery has been performed with this revolutionizing imaging tool in patients with various types of cancer, including lung, brain, bladder, and breast. If approved by the FDA to globally use this technique, it would offer great promise to physicians and patients, allowing greater precision across many different cancer types, whilst also allowing early detection and better treatment success, consequently reducing post-surgery symptoms. Thank you.